In the annals of history, few events have had as profound an impact as the Spanish flu pandemic of 1918 to 1919. This devastating outbreak wasn't just a fleeting moment in time, rather, its ripple effects were felt across the globe. The Spanish flu was a monumental event that shaped societies, economies, and lives in ways that still resonate to this day. The Spanish flu was not merely a historical event, but a global catastrophe that reshaped the world. Despite its name, the Spanish flu did not originate in Spain. A common misconception, but the truth lies elsewhere. Believed to have emerged somewhere in North America, this virulent strain of H1N1 influenza swept across the globe in the late 19-teens. The misnomer arose due to Spain's neutral stance during World War I, which allowed for uncensored reporting of the pandemic's effects, while other nations suppressed news to maintain morale. The Spanish flu, then, was a global pandemic that had its roots not in Spain but in the broader world. The Spanish flu spread rapidly, reaching every corner of the globe. From bustling cities to remote rural areas, no place was spared. A combination of factors made this possible. The world was at war. World War I saw massive troop movements across continents, providing an easy pathway for the virus. Soldiers living in close quarters became unwitting carriers, taking the flu back to their homelands. But it wasn't just the war. Crowded living conditions in cities and poor sanitation also played their part. People were living and working closer together than ever before, and the virus took full advantage. Thus, the Spanish flu became a truly global pandemic, facilitated by the unique conditions of the time. The Spanish flu was not just widespread, it was deadly. Those infected experienced symptoms similar to a severe cold, fever, fatigue, and chills, swiftly escalating to more severe conditions like pneumonia. However, what set the Spanish flu apart was its unusual victims. Unlike most strains of the flu that posed the greatest risk to the very young and the very old, this one targeted healthy young adults. The mortality rate was shockingly high, causing a significant dip in the average life expectancy at the time. For those who lived through it, the impact was life-altering. The Spanish flu, then, was not just a disease, but a deadly killer. Governments around the world were forced to respond to the Spanish flu pandemic. They were caught off guard, grappling with a health crisis of unimaginable proportions. In an attempt to curb the spread, measures such as quarantines and isolation of infected individuals were implemented. Public health campaigns were also launched, educating citizens about the virus and promoting good hygiene. Actions were taken on a scale never seen before in human history. The Spanish flu thus forced governments to take unprecedented measures to protect their populations. The Spanish flu had far-reaching social and economic effects. The world was unprepared for the strain this pandemic placed on healthcare systems. Hospitals were overwhelmed, with beds filled to capacity and medical personnel stretched thin. This led to a sharp decline in the quality of care, exacerbating the death toll. Beyond healthcare, the Spanish flu disrupted daily life on an unprecedented scale. Businesses shuttered, schools closed, and economic activity ground to a halt. An economic downturn ensued, with jobs lost and families pushed into poverty. The pandemic underscored the interconnectedness of health, society, and the economy. The Spanish flu, then, was not just a health crisis but a social and economic one as well. The Spanish flu was a harsh teacher, but its lessons have not been forgotten. This devastating pandemic underscored the importance of preparedness and international cooperation in managing health crises. It led to the establishment of global health organizations, which have been pivotal in responding to subsequent health emergencies. This period in history taught us that unity and collaboration are our best defenses against such threats. The Spanish flu, then, was a catalyst for change in the field of public health. In conclusion, the Spanish flu had a profound and lasting impact on the world. Originating in the war-torn years of 1918 to 1919, it spread rapidly due to troop movements and crowded living conditions, claiming countless lives. This pandemic, erroneously named after Spain, brought to light the dire consequences of a global health crisis, straining healthcare systems, disrupting daily life, and causing a significant economic downturn. However, it also taught us valuable lessons in pandemic preparedness, leading to the development of global health organizations and emphasizing the importance of international cooperation. The Spanish flu, then, was not just a pandemic, but a turning point in human history.